Madagascar, UNICEF is working with health officials in an effort to prevent, detect, and treat malnutrition. These mothers in southern Madagascar have brought their children to be screened for acute severe malnutrition. Here in the village of Bedeala Bas, in the Apani district, people say they face severe food shortages. Shavili, a resident of the village, brought her son to be screened.
We can't harvest anything. On market days, we buy manioc and corn. We are hungry.
Health officials are assessing all children under 6 years of age. If children are identified at an early stage, they can be treated in their homes with Plumpy-Nut ready-to-use therapeutic food and receive regular checkups at the closest health center. Malnourished children with medical complications are referred to hospitals. Elia is 10 months old and weighs only 4.5 kilos. She was admitted for severe malnutrition and later diagnosed with tuberculosis. Her mother, Masindrena, had her first child at 15, and Elia is the youngest of 7.
We are afraid because if we cannot find food for our children, they are facing death.
7 districts in 3 regions of the Indian Ocean island have been severely affected by a nutrition crisis since early 2009. The United Nations Children's Agency, UNICEF, says last year up to 250,000 children were at risk of malnutrition and disease in southern Madagascar as a political crisis and tropical cyclones exacerbated food shortages. At the time, aid agencies warned that the world's 4th largest island was on the brink of humanitarian catastrophe. Local village administrators, including Arma Laha, are overwhelmed by the situation.
People who have a bit of savings buy small quantities at the market. Those who have no money eat only Raketa cactus fruit. Look at our field. Because there has been no rain, the field is in a bad state.
In the best-case scenario, if rain does arrive, the earliest the village will have a harvest is in 3 months.